Welcome back, everyone, to Screen Me's podcast. Today, we have a really exciting episode to look forward to as we welcome Dr. Fran Yarlett onto the show to discuss intimate health, vaginal microbiome, and how contraception may affect this. Dr. Fran is a medical director at the Lowdown and also works as a GP in Sheffield with a special interest in complex medical patients and women's health. So she's really well placed to help us understand this complex topic today. And so welcome, Fran, and thank you for joining us today. And I
Thanks
guess
so
to
much for
get
having me,
started,
Jen.
no worries. And to get started, it would be great to hear a little bit about yourself, what you do, how you kind of got into this space. Yeah, just a bit about your background.
Yeah, of course. So my background is I'm a GP by trade, just a humble NHS GP. And 5 years ago, I got the opportunity to join a really exciting project called the Lowdown, with a woman called Alice Pelton, who is our CEO, who sold me this idea of how women aren't being listened to, and one of the biggest issues at the moment is contraception side effects. And when I heard about what she was doing, which was collecting the real lived experiences of women's side effects on different contraceptive methods and trying to help women by providing them better information, I
Mm.
thought, yeah, that sounds like a bit of me.
Mhm.
And here we are 5 years later. I'm the medical director. I've had loads of opportunity to speak to hundreds and thousands of women about their health, educate them, and I
Mm.
love what I do.
That's always a bonus as well. And I think, yeah, that's amazing. We worked loads with the Lowdown, and I think I'll attach all your socials down below so people can have a look through. But as you said, kind of filling that gender health gap in the real life lived experiences of these women, I think is really important. So I think what you guys are doing is great. And today I'd love to focus on how contraception may affect your vagina and vaginal health in particular. So I'd love to hear a little bit about what you guys have been gathering with regards to that.
Yeah, absolutely. So what we do at the Lowdown, thelowdown.com, is we collect your experience of your side effects on contraceptive methods, of all the contraceptive methods we can find, and we include things about your intimate vaginal health, like vaginal discharge, vaginal dryness, cystitis symptoms, because they're not sort of readily available when you go to see your healthcare professional. They don't often say, oh, you might get a bit more discharge on this pill. So that's why we're collecting the information so you can see it. And we now have over 7,000 real life reviews. But before we get into sort of all of that, we need to know what you know about contraception, Jess.
Well, you're the expert, so I'd love to hear from you.
Yeah, because there are so many different types, and how it affects you, specifically your vaginal health, is the type you're using. So we've got loads of different types, and we can break them down quite easily into non-hormonal types of contraception and hormonal types of contraception. So we can do non-hormonal first. Jess, do you know which ones I'm talking about? I
Non
didn't think.
The copper coil is definitely one of them, and condoms, I'm guessing as well. And then I'm not sure. Oh God, you'll have to, yeah, you'll have to tell me the rest off
Well,
the
you've
top of my
done very well there. I don't think you were expecting to be quizzed on your own
head. Yeah,
podcast.
I wasn't ready for that one.
Yeah, I mean, condoms and the copper coil are the most commonly used. You also have female condoms, the cap and the diaphragm, and then the permanent forms of contraception, which are sterilization and vasectomy. But when we're talking about your intimate health, the ones we need to talk about the most are
Mhm.
condoms and the copper coil. So condoms are great. We love them. Everyone should be using the condom because it's the only way to prevent STIs.
Mhm.
And we know that STIs affect your intimate vaginal health, don't we, Jess?
Yes. There's a lot
Yes,
of kind of microbial transfer between sexual partners. So yeah, condoms is definitely one to at least minimize the risk of that.
absolutely. And so they also are quite a good way of preventing BV, bacterial vaginosis, and thrush as well. Um, and that can be because sperm is alkali and your
Mhm.
vaginal pH, we want it to remain acidic. So if you're mixing acid and alkali together, it's going to increase our vaginal pH and make you more susceptible
Mhm.
to changes in your vaginal health and infections. So using a condom can prevent that and can actually make sure that your vaginal microbiome is more stable.
Hmm.
Um, and then we have the copper coil. So we know from the Lowdown users that 42% of women using the copper coil will get increased vaginal discharge,
Okay.
and 19% of women using the copper coil will get thrush. But there's a lot to say about the coils and your vaginal health. So I'm going to save it up and lecture you on it in a little bit.
Yeah, I was gonna ask, but perhaps we'll maybe save it for later, just kind of the difference between the hormonal and copper coil when it comes to vaginal symptoms. Or yeah, if you guys have seen a big difference between the two.
Yeah, well, I've got loads of stats about it,
Mm.
but it takes us quite nicely onto the hormonal forms of
Hmm.
contraception as well. So let's go through them. What's the commonest one that everyone talks about, Jess?
The pill.
The pill, the classic pill. And do you know what that pill is and which one it is?
Gosh, I think Ricavidin, is that the most common one that's given out still?
Yeah, Rigavidan's a really, really common brand because it's the
It's cheap,
cheapest and
yeah.
actually one of the safest. And that's a combined type of pill.
Hmm.
A combined pill contains both estrogen and progestogen, really common. And then we also have other types of combined contraception containing both estrogen and progestogen, such as the patch that you can stick on your skin and the vaginal ring that you insert into the vagina.
Hmm.
Um, and they contain estrogen, which is actually a really important thing for your vaginal health.
Mm.
But then we also have in the hormonal bracket the progestogen only types of contraception. And in that sits the progestogen only pill, which you might have heard of being called the mini pill or the pop, the implant, the injection, and then the hormonal coils.
Hmm.
And the difference between the copper coil and the hormonal coil that you're talking about is that the copper prevents pregnancy because it's toxic to sperm and egg. And it can also, the copper can cause a reaction in the womb lining that prevents any eggs that have been fertilized from implanting and growing into a pregnancy.
Hmm.
Whereas the hormonal coil releases a small amount of progestogen every day into your womb, which thins out the womb lining to stop any eggs from implanting and also makes your cervical mucus thicker so sperm can't get inside. So when we're talking about how the different options can affect your vaginal health,
Mm.
how the hormonal contraceptive works by thickening the mucus in your cervix, that's one very, very obvious reason how it's going to affect your intimate health.
Hmm.
Yeah. And then you've mentioned Rigavidon, but within even the combined pill, how many brands do you think you can name, Jess?
Gosh, I know Ricavidin and microglycan, and I think that's about it that I know. But
Yeah,
they all have different binders, don't they? So does that affect everyone differently?
there are so many differences. So there
Mm.
are, I think when we last checked, over 30 or maybe
Wow.
40 types of combined pill, and that's just in the UK. And
Yeah.
there are different brands all over the world.
Hmm.
And they're different brands, not only because they contain different amounts of estrogen, but also they contain different types of progestogen,
Mm.
and they can vary the type of estrogen as well, and they have different what we call excipients, which you've called binders there. So
Mm.
even if you have two pill brands that have the same hormones in, the binders or excipients can cause different side effects in women as well. It's an absolute minefield, as
Yeah,
you
I can
can
imagine.
imagine, as you can imagine. But it's really important to know all the varying options that are out there, because not only between the methods, so
Mm.
between the implant, injection, hormonal coil, mini pill, and combined pill, patch or ring, deep breath, not
Yeah.
only between the methods, but between inside the methods themselves, there's so many different brands, and
Mm.
all of those affect you and your side effects differently.
Yeah.
And that includes your intimate health and vaginal health.
Mm.
So the Lowdown is the only place where you can go and actually compare the different brands with each other to see the
That's
different
really
side effects
interesting.
between them.
Yeah. I know even from like personal experience with like friends and family, everyone has such different reactions to each of the different pills, or even different types of contraception. So that's really useful.
Yeah, absolutely. And that's from all side effects. So
Mm.
there's so many, but we're talking mood swings, irritability, skin, hair,
Yeah.
vaginal discharge, vaginal dryness.
Yeah.
Like everyone is so different, they all affect you in different ways.
Hmm.
Um, and unfortunately, it's a bit of a trial and error. It's a sort of you have to see how it suits you.
Yeah. And I guess we've kind of you've given a really great overview of each of the different contraceptives, but if we could maybe like focus on vaginal discharge, for example, and if there's like any outliers that say you've seen like reoccurring patterns with just from your guys' experience at the Lowdown between
Hmm.
different methods of contraception, say perhaps if someone suffered from, yeah, wanted to know which option may be work for them.
Yeah, of course. So vaginal discharge, we have stats, we have percentages, and
Mm.
actually they're not as different as you might think.
Okay.
So the injection is the lowest number of users who are reporting vaginal discharge at
Mm.
39%. And then the implant, the hormonal coils, and the mini pill are all quite similar. Between 41 and 44% of our users
Yeah.
report increased vaginal discharge. The highest is with the combined pill, which
Okay.
is 47%. So almost half of users using the combined pill will
Hmm.
report more vaginal discharge. Um, and that can be due to several things. It's usually the estrogen component of the combined pill, because
Hmm.
is what makes it different from the other methods. And that is going to thicken your cervical mucus, but can also cause changes on your cervix.
Hmm.
Have you ever heard of an ectropion, Jess?
No, I haven't. Please enlighten
No.
me.
So, an ectropion is a really common and normal finding in women.
Hmm.
And you have your cervix, which is the neck of the womb. It's a bit like a tube, and you have the outside here. And the inside the tube of the cervix is a different type of cell, so a different type of tissue compared to the outside. The outside is like hard and firm tissue, so it protects you. The inside is more glandular and easily bleeding. And when you have estrogen in your body,
Hmm.
so like with the combined pill or when you're pregnant, the cells on the inside of the cervix can grow out onto the outside of the cervix,
Okay.
and that is called an ectropion.
Uh-huh.
Reason I'm going on about this,
Why did
reason it's
uh-huh.
important, is because the ectropion is made of really glandular cells and tissue,
Hmm.
which secrete a lot of mucus.
Yeah.
And that could be why you're getting increased vaginal discharge when you're using combined methods
Hmm.
that contain estrogen compared to progesterone-only methods.
That's really useful. And also I think it's nice to kind of explain it so people aren't necessarily like worried about it. If it's something that's increased discharge, they might be, yeah, wondering what's going on. But that's, yeah, a good explanation of why this may be the case.
And, but with that, it's normal to have an ectropion, but it isn't normal to have discharge that's offensive, smelly, green
Yeah,
in
of
colour, yellow
course.
in colour, of course.
Hmm.
But just an increase in your normal discharge that's creamy or clear, it could very easily just be due to your contraceptive.
Hmm.
And I mean, personally, so I have a Marina coil in now, and since I've had it, I have definitely had a lot more vaginal discharge.
Hmm. And does it
Mm.
does it ever go the other way? Like, are there any contraceptive methods whereby you get a vaginal dryness, or you see a trend in decreased discharge?
Absolutely. And vaginal dryness is something that I talk about all the time. Like people just can't even come into my consulting room without me saying, "Is your vagina dry? Would you like some lube?" But it's not something women talk about often to each other, which
Hmm.
is a real shame because it can really impact you. Not only like you can feel uncomfortable, but your sex life
Yeah.
and your relationship. And we do know that it affects a lot of women.
Hmm.
Um, the best one is, according to our Lowdown users data, is the hormonal coil, where about 22%, so about a quarter of women are going to get vaginal dryness with the hormonal coil.
Okay.
And that increases for the implant, the mini pill, and the combined pill.
Hmm.
That's just under 40%.
Yeah.
So just under, 2 in 5 women are going to have vaginal dryness. And if we remember that the injection caused less discharge, the
Hmm.
injection causes the most vaginal dryness, according to our users.
That's really useful, I think, if people kind of consider where they're at prior to contraception. I think taking things into consideration, like say if you were already experiencing vaginal dryness, perhaps the hormonal coil may be the choice for you. I think that's, yeah, really, really useful. And also kind of on that, if someone's experiencing a lot of infections, for example, or a lot of thrush or a lot of BV, Is there a particular method whereby you've seen an increase in things like thrush? I know that you mentioned that kind of earlier on.
Yeah, so I mean, thrush is driven by estrogen.
Mm,
So why? Well, estrogen increases a type of sugar or carbohydrate in the vagina called glycogen,
hmm
and that's what the thrush pathogens that are called Candida feed on and grow
hmm
from. And so when you have estrogen, you have more glycogen, therefore the thrush can grow more easily.
hmm
And for some other reason, your immune system is less able to clear the Candida pathogens that cause thrush in the presence of estrogen.
Okay.
So that's why contraceptives that include estrogen, like the combined pill, patch, or ring, can
Mm,
increase the risk of thrush.
yeah.
And the other one that we need to talk about are the coils again.
hmm
So, and this really frustrates me because I have my NHS doctor clinician brain contradicting my lowdown doctor listening to hundreds of women brain because the research and all the medical guidelines
Mm,
from the Faculty of Sexual and Reproductive Health and from the British Association of Sexual Health say that there isn't enough evidence that suggests the coils are a risk factor for vaginal infections like thrush and BV.
okay.
But I hear it all the time.
Mm.
I literally hear it all the time. Women telling me I can't, I get BV all the time, I get thrush all the time because they've got a coil. Um, and so, I hear it all the time. And I
Yeah.
do think that the coils do have an impact.
Mm. Do you think maybe part of that could also be because perhaps people using the coil are less likely to use like barrier methods like the female or male condom, and then that kind of disruption that you spoke about earlier is then implicated in that?
Yeah, potentially. I mean, no one knows.
Yeah.
Nobody knows the reason. I mean, the first thing is people are saying there is no real association. I'm saying, but I hear it all the time.
Yeah.
And there's not much research into it. There's a couple of studies have been done where they put copper coils into a number of women, or women chose to have the copper coil, and then researchers did swabs at varying levels,
Yeah.
um, or varying times that they've had the copper coil in for, and they did find that they were at higher risk of having bacterial vaginosis.
Mhm.
And those researchers wondered whether in the presence of the copper coil, this was about the copper coil,
Yeah.
that bacteria that cause bacterial vaginosis can colonize the vagina in the presence of the copper coil, so
Okay.
overgrow and become more present, which is why women kept getting symptoms.
Yeah.
And in terms of thrush, now thrush is very common,
Mm.
like 75% of women will have thrush,
hmm
um, but 6% of women will have recurrent thrush, which is
Mm.
4 episodes or more a year. And there is some potential idea that if women are getting recurrent thrush with the coil in, it's because the candida has caused something called a biofilm around the coil within the uterus.
hmm
And a biofilm is where all the pathogens, all the candida pathogens that cause thrush are very tightly packed around the coil. And it means that the treatment can't get to all of the pathogens.
Yeah.
Yeah, which is why I think some women are getting recurrent thrush and BV. And as I say, the medical guidelines and the research is still saying there doesn't seem to be an association. But they also say if you're having recurrent BV and recurrent thrush, maybe take your coil out and try a different contraceptive.
Yeah.
So even though the research doesn't prove that there's an association, we do
Mm.
know that eventually some women may, if they're not getting better with treatment, may just need to take the coil out.
Yeah, exactly. And it's so hard. I think it's just another example of why we need to hear more of these stories and have more research into the area, just because there's like we need so much more evidence that kind of can explain and explore this so people can think of different methods to do as well. And yeah, I think that's really important.
Absolutely. It's always going back to the ethos of the lowdown is that
Mm.
listen to women, don't dismiss what women are telling you, listen to their experiences,
Yeah,
because
completely.
just because we don't have the research evidence does not mean it's not true. It's just may mean that it's just not been researched or evidenced enough.
Exactly. And if someone's kind of experienced the exact same symptoms as you and then has maybe tried a different contraception and that's alleviated, it definitely gives at least a path of hope where whereby you can be inspired by that and perhaps try a different method or see a different route to like overcoming your symptoms.
Absolutely. And, you know, we know these symptoms are really impactful.
Yeah,
Like, it's
definitely.
awful, isn't it, to have recurrent vaginal infections because women are embarrassed about it.
Hmm.
Nothing to be embarrassed about, but it's embarrassing. It affects your relationship. It can affect your sex life.
Yeah.
And yeah, it's not nice.
Mm. And I wondered also, like, did you have any other things that you or patterns that you've seen emerge through the lowdown with regards to intimate health and vaginal health? Or is that kind of like the main ones, the dryness, discharge, and the infection risk?
Yeah, they are the main ones, the
Hmm.
vaginal discharge dryness and increased risk of BV and thrush. And we do have
Yeah.
a lot of women coming to us about those problems and asking us. And it's very difficult for women to find out the information themselves, which is
Yeah.
why we exist and which is why we're trying to educate and get the content out there so women know what they're doing.
Mm-hmm.
Um, and you know, it also, the more information we have, the more we can push to the future to say we need more research in this area because it's affecting all of these women so much.
Yeah, definitely. And are there ways that you would suggest to these people coming to you to support a healthy vaginal microbiome or vaginal health while using contraception?
Yeah, well, it depends on your side effects because obviously there's going to be some women who just have absolutely no problem whatsoever. But if women are coming to me and saying, I've got all this discharge or I feel really dry, with our experience, we can recommend different contraceptives.
Hmm.
So if there's a lot of dryness, we can recommend different progestogens that might help. Or if there's a
Yeah.
lot of discharge, we can suggest, you know, ways to deal with your intimate health. And there is not much research evidence into this, but I can really see potentially in the future it being a case that, okay, you're starting on a contraceptive, you've got lots of discharge, right? Start your probiotics for your vaginal health now to prevent any problems in the
Yeah.
future. I am passionately against vaginal intimate washes, passionately, or products that have any perfume or scent in.
Absolutely.
Yeah, it's got to be high quality products that you all know are pH balanced
Yeah.
and have been tested to show that they are good for your vaginal and vulval health.
Mm.
So that's very, very important.
Yeah,
And if
definitely.
you are someone who suffers with bacterial vaginosis or thrush, it's worth learning about your vaginal microbiome. You know, I've done a screen me test and I know that I'm community type 4 since I've had my marina in. So I know I'm more prone to infections. And so
Mhm.
I use the lactic acid gels that you can buy, either Balance Active or Relactogel. I use them sort of like once a month just to
Yeah.
keep on top of my discharge and my intimate health,
Hmm.
which there's no research evidence in that. There's no clinical guidelines, but it helps me, so I do it.
Exactly. And I think yeah, so important with regards to the educational side of things as well. Just as you kind of mentioned, someone that's experiencing recurrent BV going straight in with a heavily fragranced wash or something. It's not, firstly, it's not normal for your vagina to smell of roses, but then also it's about addressing that root cause. Like, why am I getting these infections? Let's address the infection itself because it not only is annoying or uncomfortable, it also has future long-term health impacts. So I think it's kind of about readdressing that kind of taboo around vaginal health and that it has to smell a particular way or be completely a certain mold. And I think it's about really taking it seriously as part of our health.
Absolutely. You know, people are talking more and more about the gut microbiome, and I'm saying, but why aren't women thinking about the vaginal microbiome? Because it's
Yeah.
all related, and there's so many people who are worried about the fertility and who get pregnant and get worried. And you know, we know from research that the vaginal microbiome is implicated in this. It's
Mhm.
implicated in persistent HPV infections, which can lead to cervical cancer. So there's so much that we are learning.
Mm.
And it's really important for women to know about it, take control of it, and
Mm.
then we need to learn more about how contraceptives fit in with that in the future.
Yeah, definitely. And kind of looking to the future, how would you like to see research or knowledge around this, around the vaginal microbiome, vaginal health, intimate health, to help women with their contraceptive side effects?
Yeah, so absolutely. I think we need to firstly know more about how contraceptives are changing the vaginal microbiome.
Yeah.
As I said, there've been a couple of studies. There's been a small study in like just over 100 women with coils looking at the vaginal microbiome, but there's not been large scale studies on every type of contraceptive to say,
Mm.
okay, this was my vaginal microbiome before I started this contraceptive, and this is it
Yeah.
after. So it would be really interesting to see how it changes.
Mm.
And I think that would be a very interesting research topic. And then from there, we build a body of information. We know what we're dealing with in the future.
Yeah, completely. And then it's kind of helps with the treatment or management side of things that you also mentioned as well, which is so important.
Yeah, absolutely. We might have a better way of treating recurrent thrush or recurrent BV, if we knew more.
Exactly. And also, I think it's kind of important what you mentioned is that these treatments or management strategies are actually quite easy. A lot of them, as you said, avoiding fragrance washes or taking a probiotic, for example, if you need that, depending on what you get. I think when it seems like you need to do loads of different things, but it's actually quite easy, as you mentioned.
Yeah, it's just routine. It's part of your sort of overall well-being and health and looking after yourself, which unfortunately in this day and age, we're all really bad at, including myself, because I have 3 jobs and 2 kids. But it's so important to do these preventative things to
Mm.
prevent yourself getting ill or infections or side effects if you can.
Yeah, definitely. And so also think that's why it's so important that you guys have all your different real life stories and reviews up so that people can look into each of their contraceptive method that they're say considering and kind of also factor in intimate health as part of their decision making process rather than kind of being just prescribed the pill, which most people are just default.
Yeah, absolutely. It's all about women being listened to, women being
Mm.
able to educate themselves and make an informed choice. And I think that's what
Yeah.
we've been missing in women's health a lot is that we've been told what to do for so long, whereas
Yeah.
actually we want to be informed and educated to make our own choices. Women aren't stupid, you know?
Yeah, exactly. I mean, yeah, thank you so, so much. I think that kind of brings me to the end of my questions. I know that I've personally learned so much from this as well. So I know that our community is going to love it as well. And I want to say thank you for coming on. And did you have anything else that you kind of wanted to mention or feel like we've missed out?
No, no. Thank you so much for having me. I always love chatting to you, Jess. And just anyone who's listening, if you have questions, issues, problems, or even just an interest in contraception and women's health, have a look at the lowdown.com. It's a really great place to start.
Yeah, definitely. And I think if that people, yeah, thinking of switching or wanting to know the different side effects, in this intimate health being one of them, that's really useful. And I'll tag all your socials below. So I'm sure people will have a head over and have a look.
Brilliant. Thank you so much, Jess.
Thank you.